Hello, I'm Dr. Deya Jourdy, a fellowship-trained nasal and sinus specialist and surgeon. Let's talk about something pretty common that a lot of people have heard of, but probably don't even know that they have: a deviated nasal septum. The septum is a thin piece of cartilage and bone that separates the right and left sides of your nose. But in many people, it's shifted or crooked. If the deviation is significant enough, it can cause symptoms like nasal stuffiness or blockage due to the smaller airway on the sides of the deviation, frequent sinus infections or pressure due to blockage of the sinus drainage passages, nosebleeds from compromised airflow drying out the lining of the nose, or even trouble sleeping and snoring. The diagnosis of a deviated septum is usually pretty straightforward. An ENT specialist like myself can look inside your nose with a small light or a scope to see if your septum is crooked. Now, what about treatment? If the symptoms are mild, we often start with simple fixes like saline or medicated nasal sprays to reduce the swelling and improve airflow inside the nose. But if the septum is really off-center and medical treatments don't help, then surgery may be the best option. The procedure is called a septoplasty. It's done through the nostrils, no external incisions or scars. Your nose should look the same externally, and the goal is to straighten out the septum so you can breathe easier with a much improved quality of life. A deviated septum is common, sometimes harmless, but if it's affecting your day-to-day life, there are definitely ways to treat it and get you breathing better again.